thank you all for being here today. I appreciate it very much. My name is Kristina Miles, and I'm going to be speaking with you today, okay? Last month, you called 911 for medical help for your mother because you hadn't heard from her in 48 hours, and you live out of state. When EMS and police arrive at your mother's home, they inform you that she's okay, but she left her phone off the hook, and so the battery's dead. Just last week, you were informed that she had a fall. And so due to all these recent events, you decide, you know what, it's time to go visit her. As you pull up to your mother's home, you see an ambulance parked in the front. You walk in the door, you see your mother is severely hypoglycemic. The medics on scene have started an IV to administer dextrose, a medication that contains sugar to revive your mother. You notice one of your mother's insulin needles near her. The medics tell you that your mother took too much of her insulin and did not afterwards eat. Now her blood sugar level is at 27, and she is unconscious. After the administration of the medication, your mother regains consciousness and is taken to the hospital. It is at this moment you realize Mom needs more around-the-clock care. The above, or the story above, is truly one that many people face of their aging loved ones. With the aging of the baby boomer generation, there has been an increased demand placed on real estate, healthcare, and communities as a whole. Many family caregivers often weigh whether they should get in-home care or take their loved one to an assisted living community. Once both options are weighed, it is easy to see that assisted living communities are a better recourse than home health care. Assisted living communities offer a more cost-effective care, they can help manage your medical care, and they also do a reduction in family strain. So as my first point, assisted living communities are most cost-effective than 24-hour home care. A lot of people want to have their loved ones age in place, but you have to think about what all it costs to age your loved one in place. So, Jitworth's Cost of Care, it's a great website. It's basically a website that shows you monthly, weekly, daily, however you want to put it in, that the cost of care can be for your loved one. If you just look right here, most home health costs are annually around the $4,500 or $1,000 range, which is a lot of money. Now you might see, okay, well, why can't my loved one do the adult health care, the daycare, basically, where a CNA comes in once or twice a week? They can, but if you have an aging loved one who cannot do their activities of daily living, so they cannot cook for themselves, they cannot clean for themselves, they cannot even bathe themselves, that's not going to be conducive for you. So you end up going back to either home health care or the assisted living. And again, the home health care is at $45,000 and the assisted living is at $43,000. And what's even more disturbing is knowing that once your loved one gets to the point where they can't even be in assisted living and go to a nursing home, you're in the $90,000 range. So just something to think about. Another great website, the Consumer Report. If you see here, it's kind of the same thing. And what they're showing you is between 2017 versus 2027 of how the costs are going to go up. Again, even with home health care services, you're still at $5,000, but with assisted living, you're at the lower end of $5,000 going into 2027. And nursing homes are just out of pocket $10,000 a year. Excuse me, a month. So certain things to think about. You're saying, well, I want my loved one to age in place. Okay, sounds good. But you now have to fix either your home or your loved one's home for them to be able to get around. For instance, wheelchair ramp, just to get in the door. You know, you might have to make the sinks lower, make the toilets higher. You might even have to go from taking out the stand-up shower to putting in one where they can sit in. All these things cost. An assisted living place, those things are already done for you. You have aides that are there to make sure your person's okay. Though aides can come into the home, there are certain things aides cannot do. Aides cannot do wound care. Aides cannot give medications. And if you need that from someone, like a skilled nurse or something like that, you can get that through their system in home health. But again, it's an extra cost. So, in assisted living, all that is already just piled into one thing for you. Other things people don't think about, Other things people don't think about also would be lawn care, roofing, just overall maintenance of a home is a lot more than you have to consider. A security system. If your loved one's living by yourself, you want to make sure they're secure. A life alert alarm. All those things are monthly costs. Whereas with an assisted living community, you don't have to worry about any of that. So property taxes, property insurance, a monthly rent, all those things out the door. Also with assisted living communities, they help you manage the medical care like I was talking about before. Assisted living communities offer medical techs to administer your medications, CNAs for daily care, on staff, registered nurse, and actually some of these assisted living communities now have it to where you can transfer your primary care to whoever doctor they are under. So it can be a nurse practitioner or a doctor, and you can go to one place right there where you're already staying and have your nurse practitioner there. They can do your medications, they can screen you for anything. It's all there for your loved one. Instead of at home health, you have to call somebody else, or you might have to even get transportation to get them there. And if they're bedridden, now you're looking at an ambulance bill just to get them to the doctor. Lastly, assisted living communities reduce family strain. The National Council of Aging state that 60% of elder abuse and neglect incidents are the perpetuator is a family member, 60% of the time. Also, approximately 1 in 10 Americans age 60 plus have experienced some form of elder abuse. I can tell you firsthand, if you're trying to manage your life, your own family, your own bills, and then you're giving your parent or your uncle or your sister or whoever else is aging and having those struggles, it will put a strain on you. And though we think we're the best people in the world, we want to do the best, sometimes these caregivers, it's too much, and they neglect them, and they take them to places and they leave them. I see it all the time. So just something to consider. I just wanted to also say that my family and I have also been through this with my uncle. He is actually more like a grandfather to me than an uncle. He actually raised my mom and his 7 other brothers and sisters. So we've gone through this 2 years ago, and we did this exact same research. And I just wanted to put something together for people so that when it's their turn, they know, you know what, Kristina's already told me, assisted living is the way to go. In the long run, it's going to be easier for the loved one, it's going to be easier for yourself. So I just wanted to say that it's very taxing trying to collect information from different sources and trying to figure out finances and daily cares of your loved one. When your loved one, you would love for your loved one to age in place in the home that they've built or that they have taken the time to pay off, but unfortunately it's just too hard sometimes. And again, like I said, the baby boomer community is aging. This is the best recourse, most cost-effective recourse. Medical care managed and reduction on family strain if you just go ahead and look into assisted living.